Conversation we're live on Facebook. Get on Facebook at Nigeria Info 92.3 PA and you can drop a message. All right. If you have any questions, do well to send in those messages. You can also send that message via WhatsApp to 0809 030 6416. 0809 030 6416. My name is Constance Mega. All right. So joining me right now for this conversation is Dr. Modupe Oyadotun. I did great, right?
Yes, you tried. Thank you very much. It's glad to be on the show this afternoon.
All right. So Dr. Modupe is a public health physician. So this is what I want to know. What is so special about this World Immunization Week?
Thank you for your question, Constance. World Immunization Week is quite important.
Okay.
And it's special. It's celebrated every year, and it's celebrated every last week in the month of April. So it's not just 24th to 30th, as you said earlier on.
Okay.
But the last week in the month of April every year, we celebrate World Immunization Day. Then why is it important? It's quite important because we want people to know the importance of vaccination, because there are so many vaccine-preventable diseases that is killing a lot of people these days, and especially children under 5 years. And in Nigeria, over 800,000 children die annually from these vaccine-preventable diseases. And so because of this, assuming they are vaccinated, then it's preventable. They won't die. But because they are not vaccinated, they didn't take up the parents didn't take up this opportunity, and they lost their children. So that's why WHO now said, what can we do to prevent this death and to prevent even the future generation from having this kind of diseases? Then we celebrate vaccine. We celebrate Immunization Week every year, and we try to educate people. We enlighten them on the importance of vaccination, and we also take vaccine. We take immunization close to them. Okay. So we go around, we talk to people about it, and we encourage them to come to the facilities to come and get immunized. Oh. If they have missed any form of immunization before, we tell them, don't worry, just come around. And it's free.
Oh, interesting. So I was also going to ask how available and accessible childhood vaccines are in River State.
Okay, I'm from University of Port Harcourt Teaching Hospital, and from our own facility, vaccines are readily available. We have immunization clinic that is being run by the Family Health Unit, and it runs from Monday to Friday every week. So anytime you come in the morning, Monday to Friday, between the hours of 9 and between the hours of 8 and 2, definitely you will be vaccinated. So it's readily available. And assuming maybe we are out of stock for a particular vaccine, we give you dates to come for it, and we ensure that you come.
Okay. But you said that's for the what's it called now? The facility where you work.
Yes.
Okay. All right. Although I've heard some other people talk about how at primary healthcare facilities in the States, vaccines are also available.
Yes. We also have them at every primary health center around. In every local government, there is at least a primary health center. And so in that primary health center, part of their function is to vaccinate, to immunize children. So it's also available in any near facility close to you, wherever the patients are.
Okay. So you've already told us that we have about, did you say 800 or 8,000 children?
800,000.
800,000?
Per annum.
Oh my goodness. So 800,000 children dying every year in Nigeria from... At minimum. So it could be more?
Yes.
Wow. So, and they're dying from diseases that could actually be prevented.
Yes.
So let's talk about why many people still do not take their children to get vaccinated against, some of these childhood killer diseases. Between ignorance, stubbornness, and maybe religious or cultural beliefs, which one would you say has the highest?
All.
All.
But in recent time, religious is now playing a major role. Most people now believe in what their pastor says, and they feel, my pastor is saying that, we are healed by this, we are healed by that, so don't go to the hospital. So based on that, they are not accessing care. And also some parents they don't understand the importance of this vaccination. So that's where ignorance comes into. They don't understand that with vaccine, one, it saves cost. Because when the child is sick, you have to take the child to the hospital, you spend so much admission fee and everything. And eventually the child may even die from this preventable disease. So it saves cost, it saves the family from mourning, from death, and also it's helped the child to grow well and to be healthy. So due to ignorance, they don't understand all this. They don't go to the hospital. They feel, vaccine is going to, they only hear about the myths that people tell them, if you take your child for vaccination, the child may become an imbecile, the child may become this, the child may become that. So based on that, they will stay back and not take the child to the hospital. So ignorance too plays a major role.
So where do we have most of these people who are refusing to take their children for vaccination? Are they in the city, or are they more in the rural communities?
They are everywhere. We have them everywhere. But they are more in the rural area. But we also have them in the urban region here. Port Harcourt is urban. And we see people coming to the hospital, they will tell you, no, they can't take vaccine. That, no, it's not healthy, it's not good. They give you 1,001 reasons why they won't take it. So, but it's more common in the rural area.
So what are the childhood killer diseases? Let's talk to us about some of them that these vaccines can actually prevent.
Okay, I will start from the day a child is born.
All right.
We have BCG.
Okay.
And what does that BCG do? BCG prevents tuberculosis. So, we are in a place where tuberculosis is endemic. Prevalence of tuberculosis is quite high in Nigeria. And overcrowding and so many things. So a newborn is susceptible to that infection.
Okay.
So in order to prevent that, we vaccinate the child from day one. Before you even go home from the hospital, we give BCG.
Okay.
So to prevent tuberculosis. Then at 4 weeks, we give hepatitis, and we also give polio. So that's to prevent hepatitis, to prevent polio. We also give measles vaccine. So measles is to prevent measles infection. And if that child eventually comes down with measles infection, it won't be severe.
Okay, because I was going to come to that as well.
It won't be severe at all. Then we also give injection for tetanus.
All right.
We also give for diphtheria. Recently we had rotavirus. It's been added to prevent diarrhea. So we also give injection for meningitis. We give for yellow fever. So many diseases that we can prevent and that are quite prevalent around here.
All right. So back to the question I said I was going to come to. People take the vaccines, right? And they're sure that their child took the vaccine. But then later on in life, perhaps when the child is maybe in primary school, the child comes down with maybe chickenpox, measles, and then the parents wonder. I thought this girl, this son of ours was vaccinated when he was quite young. What's happening?
Okay, thank you very much. So, earlier on I told you that vaccine, one, prevents the disease. That's one. And it can also, if that disease that eventually happens, it makes the severity, it makes it to be mild.
Okay.
So that's it. So when a child that is fully vaccinated comes down with measles, the severity in that child will be, in fact, the measles will be very mild. It won't be severe compared to a child that is not vaccinated at all. So vaccination also just like COVID, when you take COVID vaccine and you come down with somebody now comes down with that COVID, the severity in the person that took COVID vaccine will be mild. So the effect will be mild in such a person compared to someone that did not take the vaccine at all. So that's same thing with the children's vaccines. So when they take the vaccine, fine, it's to prevent or to minimize the effect of that disease if that child comes down with it.
Interesting. Well, we're taking questions as well. If you have any questions pertaining to what we're discussing, we're talking about immunization. You can as well send a message via WhatsApp to 0809 030 6416, 0809 030 6416. Or you can head on to Facebook and drop a comment there at Nigeria Info 92.3 PH. All right. So you can also put a call through, but let's take one message. Perhaps when she's done answering that one, we can take a call. Let's see. So someone here is asking, the immunization you're talking about, is it more prevalent in the rural or urban areas? And are there epidemiological studies to ascertain it. Donald from Iguruta. So I think this person is asking. He's not asking if immunization is prevalent. He's asking if the diseases, those childhood killer diseases, if they are prevalent in the rural areas than in the urban areas.
Okay, childhood disease is present everywhere. It's not prevalent to rural or urban area. It can be found anywhere.
Okay.
So that's why we say everybody needs to be vaccinated, whether you are from the rural area or you are from the urban area. So vaccination is for everyone.
All right, but there are people who actually believe that because of the environment in the rural communities, right, that children are more likely to be sick in those places than in the urban areas.
Okay, there are some diseases too that are also that are also prevalent in the urban area. So it's not as if because they are in the rural area, that's why they tend to be sick more than those that are in the urban area. Fine, maybe someone in the rural area may be prone to diarrhea because of the environment, and someone in the urban area too may be prone to some other form of disease because of the exposure too. So that's why we say vaccination is for everyone. We are not saying it's for rural people or for the urban people. It's mainly for everybody. A child born in the rural area needs vaccination, and he needs to take all the vaccines, not a particular type of vaccine. I can't say because that child lives in a place where there are no good toilet facilities, so the child is prone to diarrhea, so that child will take rotavirus alone. No. That child has to take all vaccines meant for appropriate age.
So you're saying that even a child who is born in a family where they're very well to do and the environment is very clean, they are feeding the child properly, the child needs to take all these vaccines?
Yes. Because that child is not going to be in that house forever. The child will definitely go out. There will be exposure to one thing or the other later in life. So that child needs to be fully vaccinated. You can cage your child at home from age 1 to 5 or even to 10. But at one point, that child will go out. We go to school, mingle with people, and do some other things. So that everyone needs to be vaccinated fully.
All right. So I have another one here. Please, can you ask your guest the name of the vaccine that young girls take to prevent cervical cancer? Mrs. Oni from Port Harcourt. So is there a vaccine like that?
Yes. Okay, so it's part of the vaccine that is being used to prevent cervical cancer.
Is that one free?
It's not.
All right, because I heard cancer and I'm thinking.
It's not free. It's not.
So at what age should a person get it?
At the age of 9, first dose is given at the age of 9. Then the second dose is 3 doses.
Okay.
First dose at contact, maybe age of 9. Between 9 and 12, you can take it. You can take it anytime. Then the second dose will be taken 4 weeks after. Then the third dose will be at after 6 months.
Okay.
So it's been used to prevent cervical cancer. We call it HPV vaccine.
All right. So let's go on a commercial break, and when we return, we're still talking immunization. If you have any questions, I said that earlier, send a message, all right? So 0809-030-6416, 0809-030-6416. And when we return, we'll open the phone lines as well and take your calls, all right? So do stay tuned. It's Mind, Body, and Soul. World Immunization Week. Dr. Modupe Oyadotun, a public health student, is very important. If you have any assistance and the condom to 07930002, 07930002, 07930003. All right, this message here. Let's see. You're done with these vital capture, right? Right. So let's this one. All right, call me back. Okay. Good afternoon. Please let your guest measure the disease can be prevented by BCG vaccines. Thanks. No.
Okay, BCG vaccine that was stage 4.
Oh, okay.
So then,
at what age?
Okay, so vaccine. Once you go for vaccination, they always tell you when to come back, and it's all on the vaccination card. So even till the age of 5, children are still vaccinated. So once they take one, then after one, they go back at 3 years. Then they take another at 5 years. So they do not schedule that is there, and it's already on the card. So you see the time to go for the vaccination. And some even include the HPV vaccine. That's okay. They put it already on the card that the child can come at 9 years, anytime from 9 years, and also, but usually most encourage that you take vaccine till age 5. That's what we propose most times.
Okay, but then now as they grow, they have to go back. All
right.
All right.
So the child can go back.
Okay. Hello.
Hello.
Good afternoon. What's your name?
Good afternoon. Please, can you hear me?
Yes, loud and clear. What's your name, please?
Okay, my name is Kuleji.
All right.
I said that after this dose, at the day of birth, they will come again, I think, 4 weeks.
Okay, I think you're modeling it up. She was actually referring to the vaccine to prevent cervical cancer. She wasn't talking about the one for.
But in my case,
in your
that
case,
was last 2 weeks when my wife gave birth.
Okay.
It was struggle before they even gave the first dose. Because they were telling me that one is for about 20-something children, that they cannot do it for only one baby. But finally, they did it. So they take nothing from me, they did it. But what they wrote in the card, they said take that 29 or 20-something me. So it's even an amount. So I'm confused now.
Okay, hold on. Let's understand this. The wife gave birth to a child, right?
Sorry.
No, she's not asking yet. I want to understand. Okay, that happens. I wanted to understand. Keep going.
Okay, we've won but so 6 weeks we go for not vaccine, but it's not see that another type of sense that became as
I do want to get he's saying that the very first is what 6 weeks. I don't know. I want to really get clearly.
I want to say again. Maybe he went to a facility where there's a lot of children. And opening a event for development for a lot of children. So people are saying child list. We leave people to come. And at that time, we'll put a lot of together. They will put all of us in.
Okay,
yes. We want to avoid waste.
What's the date?
So they just speak today. They have to come to the school children care we give.
But what was it?
No, I don't know what it said.
Okay. Immunization against facial blindness. What disease? All these cause irreversible blindness.
These are infectious diseases. We have diseases, not direct. So cataract also is important to the list.
Okay, so it was vaccines. Those were for those children under 5. For
diseases.
Right. They want to take the APV at the age 7 and 40 treatments. Okay.
Yes. Some they say can take 3% and 7 weeks. So that's what's been given to the woman, age 7 to 40.
Okay. Then you mentioned prostate cancer in your events. I can't stop. Okay. Let's see. All right, we're still taking your calls though. 173-000-000. What is government organizations doing to encourage the uptake of vaccines in the area? About that. Please, could you add that?
Okay, so thank you so much for that question. Government, they are doing something. They are trying, but they still need to do a lot. So presently, we have to get the children vaccinated. And they also go talk to the parents, even go to the community leaders, because they feel that when we health workers go, they may not listen to us. Okay. But when their community leaders talk to them, then they will listen. So government, community leaders, and so the community leaders are the ones that encourage their people to go for it, to them, so their community leaders as advocates for immunization. So that's one because these vaccines are not produced in Nigeria. They avoid waste as much as possible. That's why we said we can't just open one vaccine for one child. A vaccine that covers a lot of children, open for one child, in order to avoid wastage because they are quite expensive. Okay. So government is trying as much as possible to make these vaccines available. Though they still need to do more and they are doing more. But for now, they are doing their best. And so I have a lot of best. So part of the benefit is that it saves cost of health care. And mortality, death, it prevents death. So I'm here to advocate, to talk to people that vaccine is very helpful. It's important to be vaccinated. Vaccinate your children. Vaccinate yourself. Adults can be vaccinated. We can vaccinate ourselves against COVID, yellow fever, hepatitis, HPV vaccine. So many vaccines.
About particular one that for pregnant, the immunization they get.
Yes.
How does it work? Because I've heard women say, I did not finish the dose.
So most times, for tetanus, that's what we give. TT, that means the layman's word, TT. So in pregnancy, we give at when come register, we give TT. Then we also give them as the pregnancy progresses. So most times we give 2 doses, depending on what the person present during pregnancy. So, and ideally supposed to be 5 doses.
Okay.
So if you take 2 doses in this pregnancy and you want to the delivery can around and continue the schedule and just complete it. But most times, most women don't come back. They wait till the next pregnancy. So when they come during the next pregnancy, we continue. And we continue.
All right. All right, we'll go back. So someone is still asking, please, the 5 diseases in children are, and the vaccines against such diseases. Can you just run us through those
5 killer diseases?
Yes, please.
I don't know. We have a lot of killer diseases in children. We have malaria is one of the killer diseases in children. In fact, it's one of the major causes of mortality in children.
Malaria?
Malaria, yes. Malaria. So it's major cause in under 5.
But we yet to start receiving the vaccines.
We are yet to start. We are yet to start. In Nigeria. So we have tetanus. Tetanus can cause death in children. So breast and alcohol is not properly managed. Tetanus can set in and child can die. So many things can cause death in children. So we have so many diseases that can cause death in children.
All right. So when you were talking about what health care and government is doing, and you were mentioning going to rural communities to get the people vaccinated, I was thinking, because when I was in school, in primary school, we used to have health workers come around.
Hello. One student is vaccinated at that age of 9.
Okay, thank you very much. She's going to answer that. All right. So I'm sure you got a question.
Yes. HPV vaccine can be taken at any time before the age of 45. So it's not necessarily the age of 9, but from age 9 you can take it. So it's not as if there needs to be a symptoms or anything if you don't take it at that moment. What's the S of taking the HPV vaccine? It's just cervical cancer. So when someone is 9 years old, it's still with cervical cancer at that moment. We're just even to prevent it to prevent the future occurrence of cervical cancer. So you can take it anytime.
Hello.
It doesn't have to be the age 9.
All right. Hello, you're welcome. What's your name?
Yeah, this is the line.
All right, okay, go on.
I wanted to ask the doctor on this here. But you are not able to establish if the child was vaccinated against TB, like in BCG. When that is, what do you do? Because the child at point you cannot establish if he took or not. So, what do we do?
All right, thank you very much.
Thank you very much for that question. If you check your left hand, you will see mark. If you are vaccinated, again, you have my right. So I don't know.
What are some people who like have marks?
So most times
heal very nicely.
Yes,
I think I touch your skin.
Fine, we heal nicely. Most times, most of us have mark. So that one we can. Then two, if you cannot establish, there is nothing stops you taking the child to go and take. So you take the child to the hospital.
There's no overdose of the vaccine.
No overdose of the vaccine. To be on the safe side, you are not sure if this child is vaccinated. Let the child get the vaccine.
Okay. Living with them.
Yes.
I just want to be sure that this child
if one is not there, you are not the child is vaccinated. Then take the child to the hospital and get the child vaccinated.
Okay. All right. So the question I was asking more now about the vaccination program in schools. What exactly they give when they get to school?
Yes. Now you just go to vaccinate the child.
All right.
Parental consent is important. So if you are going to
anybody call my
that was then, but now I have opened. So if you want to be sued, you have to ensure that there is proper. There must be publicity and parental consent. Okay, some people are coming to the school to vaccinate the children, and most times we give oral polio. We give polio to children, but most times we give oral polio vaccine in schools.
Ah, interesting. Okay. Good afternoon. Please, what vaccines can be recommended for women? Mrs. Oni from Port Harcourt. All right, we'll come back to that. Hello. Hello. Good afternoon. What's your name, sir?
Yeah, of course. And Walter is coming.
All right, Walter.
You're against the house. I want to ask, like some women, most of them when they vaccinate you are in children, will there be an education like cards?
Hold on, Walter. Walter, are you medical personnel?
I am not, ma.
So how come you know that most women do not know that their children are vaccinated? Most
of them.
Can I have a number of this most?
Well, I have to say because I know most of those that are not educated.
Okay.
Yes. Assuming their children are vaccinated, won't they get cards to indicate?
All right. Thank you very much, Mr. Walter. So, could you please help us understand? Vaccinated child and the mother is not aware. How come?
Okay, thank you very much. if a child's vaccinated, and the mother is the one that took the child for vaccination, the mother will be aware. Then we also have card. We have immunization card. Because even some schools require a request for it before admission. So there is a card. In that card, once a child is vaccinated, it's been written. The vaccine given to a child will be documented. And the next visit will document. Because I mentioned that earlier on. So and that vaccination card must be kept because every child requires it at one point or the other. So vaccination card is available for every child that is vaccinated.
So is it possible to come to the hospital bearing a child and say, I bet more vaccinate them more. And I didn't come with any card?
Okay, so if you get to the hospital the first time, you get a card. That is vaccination card for that child.
Okay.
So before the child is being vaccinated, they will open a card. And we also have record, not just the card alone, we have a ledger, a record, where that child's name and details will be recorded. And the type of vaccine given to that child will be recorded. So it's always there. So the child has a card, the mother goes home with the card, and we also have our home copy and we have our documentation available. So any child that comes for vaccination must come with a card if you have gotten one before. But if you don't have it first time, then you get a card.
Okay, so here I am in the hospital. There was a break and the card got burnt, or something happened and I can't find it. But I'm sure my baby has been vaccinated like 4 times. So can you pick it up from there?
Yes. So we'll ask you some questions. Which hospital? If it's the same hospital, we have record. But if it's a different hospital, maybe
we came from another state.
From another state, you are new, and so you are now telling us that this child is so months old, and this child is fully vaccinated. I've gone so time. We ask you questions. When did you go? I go at so time. I was there this time. I was there this time. So, but
okay,
because we know the child is supposed to. Okay, let's assume the child is 9 months or 8 months. We know this child should have been up to this level.
Okay.
So, and we ask you questions up to that. So if you provide answers, they know that yes, the child is fully vaccinated. And if you're not able to,
so what if language barrier is making it really impossible for me to provide the answers that you require?
Then we have to get someone that will be able to communicate with you properly, that will be able to interpret and tell us exactly what we need to hear.
Okay. Vaccines can be recommended for women.
Okay, as women, depending on, we have HPV mainly for women.
Okay.
So just prevent cervical cancer. And we also have hepatitis. We have, if it's a woman of reproductive age, we can recommend tetanus. Then we can also recommend yellow fever if the woman lives in a yellow fever endemic area or the person wants to travel or something, yellow fever. So generally, adult vaccine can be taken by anybody. But the one that is specific to women is that hepatitis, human papilloma virus, that is the HPV for cervical cancer.
All right. So here's a question. Good afternoon, Constance and the guest. About that mark, my second daughter don't have it. She was fully vaccinated. Somebody told me that it was not done well. That's why the mark did not show. Please explain. Safia Lamido is asking.
Okay, Safia. No problem. So once your child is fully vaccinated and you have the card, you have no problem. So as Constance said, that some people have their skin won't even show that they are vaccinated or something. So it's okay. But you are sure that the child is well vaccinated, went to his center to vaccinated, and you have documentation that you are caught.
Is there anything not properly vaccinated?
There is
not well done.
As long as you go to to facilities where trained health workers are, then you are good, because we have techniques of giving vaccine.
Okay.
And they are trained. So they know how to do it. They know what to give. They know how to give it. So no problem. I encourage people to go health centers, go to hospitals, approved hospitals, for proper vaccination.
All right. Let's see. For hepatitis B vaccination. So for hepatitis B vaccination, is it who actually needs hepatitis B vaccination?
Okay, most times anybody can take hepatitis B vaccination, but most times we encourage health workers or those that do needles. Yeah, mainly health workers. We encourage them to take, but anybody can take hepatitis B vaccination. So, and you can get it at any health center around you, any primary health center around you, or any hospital, secondary facilities, that's general hospital, or any government hospital around you, you can get hepatitis B vaccine.
So we're discussing immunization 923-0002. 923-0003. Now, for the benefit of the people or whoever it is that did not join, well, could know what vaccine actually do for the individual.
Okay, so before I go to that question, I just want to talk about the big catch-up.
All right.
Yes, that's our team for this year. Not even talk about it. So let's just quickly say something.
What is the NMA doing to mark this week?
So let me just quickly talk about it, the big catch-up. So we talk about the World Immunization Day week. And this year's theme from WHO is the big catch-up. Why are we talking about the big catch-up? What is the reason? Because of the COVID pandemic, children were not vaccinated. People couldn't access health care then. They couldn't access vaccination. So because of that, the rate of vaccination dropped. And it took us back to 30 years. Yes.
Just for
2-3 years. Yes, from 2020, 2021, we couldn't really vaccinate. People couldn't access vaccination. Since and consumables, so many things. So we were not able to vaccinate properly then. So based on a lot of children were not vaccinated around that period. So we went back to 30 years record. So now this team is being used in order to ensure that we go back to 2019 record. Okay. We want to meet our 2019 target. So that's why this team is up now. So why are we talking about the big catch-up? What are we catching up? We want to and get vaccinated. So we want to ensure that those that missed the vaccines during that period, because they couldn't access care, there was restriction, they couldn't move about, or they just felt they put to bed then, and since they could not go for vaccination, so they just ended everything at that period. So they've not been coming to the hospital for vaccination. We want to encourage them to come now. It's never too late. That you can still come around and get vaccinated. And because 50% of children in Nigeria have vaccinated, and it's too low. It's quite low. And recently we are seeing a lot of diseases occurring. Diphtheria, we can that people are having diarrhea. So many diseases are coming up recently. And these are preventable diseases. So that's why WHO now said, we need to do something about it. Let's get people to come back and get vaccinated.
So basically, anyone who had their babies within 2020 and 2021 should come back to the hospital with that child.
Yes.
And get the child vaccinated.
And get the child vaccinated if the child is not vaccinated.
Oh.
And if anybody, even those, if you have your child in 2019 and maybe the child's supposed to take vaccine 2020 and you couldn't go, so you can still come around.
So it's not too late.
It's not too late.
The child has not outgrown the vaccine.
Not at all. You can't outgrow vaccine. So you can always come around.
Okay.
You can always come around. So we are encouraging them to bring their children to the health facilities for proper vaccination.
All right. So what about an adult who is not sure if they were vaccinated against maybe something like measles?
Adults.
Yeah.
Already they must have developed herd immunity to measles.
Okay, someone is asking, where can I get the vaccine to prevent the cervical cancer? And is this the one that brings the right hand mark?
No. BCG is the one that brings mark. Cervical HPV vaccine doesn't bring any mark. So you can go to any health facility. I'm not sure if primary health centers have it, but you can go to a tertiary health center or some private hospitals. They have it.
When you say tertiary health center,
you can come to teaching hospitals.
All right.
You can come to teaching hospital. You can go to Last River State Hospital. You can come to UPTH, and you can go to private hospitals. I think some of them do have it, but I know it's not available in our primary health centers.
Okay. All right. So we're going to have to wrap up now. But for this community where they do not have a primary health center, what is their fate? We'll go on that commercial break, and when we come back, she'll answer that, and then we'll wrap up the conversation. Stay tuned.